Hi, good afternoon, everyone, and thank you for joining us. We will begin in exactly 1 minute. Again, we want to extend a warm welcome and welcome to today's webinar, the family part of the Family Inclusion webinar series. Next slide, please. And this is session 2, stages of family recovery. Next slide, please. This webinar is sponsored by the Northeast and Caribbean Mental Health Technology Transfer Center, or MHTTC. We're housed at Rutgers in the School of Health Professions in the Department of Psychiatric Rehabilitation and Counseling Professions. My name is Kathy, and I'll be facilitating this webinar today. MHTTC is funded by SAMHSA, the Substance Abuse and Mental Health Services Administration, to enhance the capacity of the behavioral health and other related workforces to deliver evidence-based and empirically supported practices to individuals with mental illnesses. Please visit the MHTTC Network website for additional information at mhttcnetwork.org. Next slide, please. And if you're interested in staying up to date with the events and products the Northeast and Caribbean MHTTC is providing, please sign up to receive our email communications. You can sign up at the bit.ly link provided on the screen. Next slide, please. And following the webinar, you'll be asked to complete a brief survey. We value this feedback and use it to improve our activities and inform future activities. The surveys are also important because of our continued funding is linked to the completion of these surveys. So we thank you in advance for your feedback. Next slide, please. We want to let you know that this webinar is being recorded and will be posted to our website along with the PowerPoint slides in the next couple of days. Next slide. This presentation was prepared for the Northeast and Caribbean Mental Health Technology Transfer Center under a cooperative agreement from the Substance Abuse and Mental Health Services Administration. All material appearing in this presentation, except that taken directly from copyrighted sources, is in the public domain and may be reproduced or copied without permission from SAMHSA or the authors. Citation of the source is appreciated. Do not reproduce or distribute this presentation for a fee without specific written authorization from the MHTTC. And at the time of this presentation, Tom Codir served as Acting Assistant Secretary for Mental Health and Substance Abuse at SAMHSA. The opinions expressed herein are the views of the speakers and do not reflect the official position of the Department of Health and Human Services or SAMHSA. We encourage you to interact with our presenters during the webinar by using the chat feature. Please post any comments or questions you have in the chat, and I will collect your questions as we go and ask them of the presenter during the Q&A times toward the end of the presentation. During the webinar, our presenter may pose questions to you, so please use the chat feature to answer these questions as well as our poll functions. Next slide, please. The MHTTC network uses affirming, respectful, and recovery-oriented languages in all activities. This includes language that is strength-based and hopeful, inclusive and accepting of diverse cultures, genders, perspectives, and experiences. Language that is healing-centered and trauma-responsive. Language that invites individuals to participate in their own recovery journey. Language that is person-first and free of labels, non-judgmental, and avoids assumptions. And language that is respectful, clear, and understandable and consistent with our actions, policies, and products. Next slide, please. Now let's begin our webinar. We have Dr. Michelle Sechner with us today. She has focused her career on the promotion of health and wellness for people with mental health conditions, their families, and the staff who support them for over 25 years. She has worked in a variety of settings, including academia, outpatient mental health programs, family advocacy organizations, psychiatric hospitals, nursing homes, and training services. She conducts research, teaches and mentors students, and consults with state psychiatric hospitals in the implementation of evidence-based health practices. She is also involved in family advocacy in New Jersey. We also have Valerie Ferry with us today. She's the Director of Workforce Development, Family Training and Advocacy Center and has worked in outpatient, inpatient, and administrative roles within Philadelphia public behavioral health system for 20 years. She oversees various programs at the FTAC that champion the importance of family within behavioral health care and works collaboratively with local universities, behavioral health organizations, and family members to educate the workforce and support providers in their efforts to become more family inclusive. Welcome, everyone, and I'll turn it over to our presenters.
Welcome, everyone. We're so glad you joined us today. We're going to continue our discussion about family members, and this week is family recovery, which is one of my favorite topics. Our objectives for today are just to explore a little bit more about family recovery and identify the skills and information for each stage of recovery. So I'd like to begin by having you turn to your chat box and think about what recovery is or could be for family members. So turn to your chat and indicate what are your thoughts about recovery for family members of people with mental health or behavioral health conditions. What do you think that looks like? What would the family member be doing or feeling? What would the relationship be like between the service recipient and their family member? And someone has said ability to communicate, some sense of peace. Absolutely. And I'm sorry, you're going to see me turn my head dramatically. I should be wearing my glasses, but I'm not. So I've got two screens. So one screen shows my chat. And Valerie, if you want to help me.
Yep. Someone said open discussion, and I would agree. Open discussion is a huge part of what family recovery is going to look like.
Yeah, being sure to have sort of an open dialogue between the family members themselves and also the family member and the service recipient and the service provider in the family and the consumer. So that transparency is really helpful.
Becoming part of a team. Ooh, I really like that one. We're going to be talking more about that, especially in our third series about how family members really are part of the team.
Absolutely. Yes. So you all are really sort of thinking about this, also growing and feeling positively together and positively about the situation. You all are absolutely, I think a lot of what you're talking about and commenting, which is bravo to you, is at the end of the recovery continuum for many family members. I think that we'll be talking about the stages today because it is a process, just like recovery is a process for people living with mental health conditions. Recovery for individual family members is a very unique process, and it's actually different. I've worked with parents who have children, pardon me, living with behavioral health conditions, and the mother might be in one level of recovery, the father might be in another level, and then the siblings may be yet at another. Valerie, do you have a comment you want to make?
Yeah, no, I totally agree. And I think that's an important thing to keep in mind today when we're talking about stages, is that you're going to find family members at different levels. So that might feel a little tricky to try to address all of their needs, but we're hoping that the overview that we're going to give today will give you a better sense of those stages and how to best interact with family members based on those stages.
Yes, and the language you all are using is perfect. It's like transformation, absolutely, just sort of coming to a new space. One of my favorite resources to turn to when thinking about family members and how to help them move forward in recovery, and I should say, I said this last time, but I should say that I identify as a family member. I have someone in my life living with a severe mental health condition that I support. So this is very personal for me, but someone who has really supported, my thinking about recovery for families is someone named Leroy Spaniel. He's unfortunately no longer with us, but he was someone from Boston University for many years, and he has a great workbook on family recovery that our stages are based upon. But the way he thought about that was, and you all have already mentioned a lot of these kind of concepts, but families recovering means facing the reality of our experiences and its emotional impact and readjusting our attitudes, feelings, perceptions, and beliefs about ourselves, others, and life in general. And also to have a life that includes hope, personal meaning, intimate connections with others, and goals for the future. And if you think about it, that's a very parallel process to people living with behavioral health conditions, substance use or mental health conditions. That's what recovery looks like for them as well. So families have to go through that same sort of process of managing their grief, coping with loss, and then embracing the new reality of their loved one who has become sometimes slightly different person and grown in a different way, and the family has to grow with them. So let's kind of go with two assumptions at this point. Considering family recovery, and the first is we've got to have hope. We've got to be the holders of hope, just like we hold out hope for service recipients. We have to hold hope that families can recover and individual members can recover. And it may take a long time. It may have many twists or turns, but it's really important that the family feel that they can recover and that you have the belief that they can recover. I believe, and I think that we all believe in helping fields, that people can learn and grow throughout their lives, regardless of who they are or what their situation is, that we sort of evolve as people. And maintaining a strengths-based approach, we're making sure that we're thinking about families as resilient, as strong, as managing a difficult situation. And when we put that strengths-based thinking seed in our brains, we're sort of helping to identify that more. And also, I mean, sometimes a tendency, having one foot in the family world, as I do, and one foot in the practitioner or provider world, I know that at times in mental health settings or in behavioral health settings, there's a lot of talk about how difficult families are and how challenging they are. And yes, absolutely. But that passion can be turned for good, as we talked about last time. I think we'll talk more about that as well. Family recovery, just like recovery for people living with conditions, is really influenced by a number of factors. Things like what resources does a family have? Do they have access to a computer or a car? Are they on the bus line? Also, culture is a very, very important factor about recovery. How is mental illness perceived in the family of origins culture? Is it something to be ashamed of, or will the family be blamed for the actions of the individual or for their illness? Also, for supports, are there additional resources through extended family or friends? Is the faith community likely to be a support or help out the family? Additionally, we have to be aware, of course, of personal mental health status of individual family members. There may be pre-existing mental health concerns of the family member, but they could also be, the development of depression and anxiety, which is very common in family members, particularly if you live with someone with depression. I think it like increases your likelihood of developing depression yourself by 30% or more. So it's very important to know all of these things and understanding what supports a family may have, and knowing the supports a family has can help them go through the process of recovery much more. Things like reliable transportation, enough money for daily life and food, strong neighborhood connections, a supportive faith community, membership in family peer groups like NAMI or MHA or DBSA, and deep friendships that can help a family get through difficult times. And lastly, I think a family has to have some resiliency, the ability to sort of bounce back after difficult situations. And a lot of families have that resiliency. You'll see, and I'm sure you have examples in your work where you've helped people and they've been through a lot, but they keep bouncing back and they keep being resilient. So I'm going to turn it over now to Valerie for a little bit of a discussion.
Okay, so we were able to talk a little bit about some of our perceptions around family recovery or what it looks like. But Dr. Zechter and I are curious about what are you all doing to support family members and their recovery? So this might be something that you personally are doing, or maybe something your agency is doing. So just the action steps that you may be taking in order to support family members through their process of recovery while supporting their loved ones. So feel free to put that in the chat and we can talk about some of the things that we're all doing and maybe get some ideas from others about what they're doing within their own work.
And I know, Valerie, I've seen things like family groups or family councils. What examples have you seen in your work?
Yeah, family groups, advisory groups have been a huge influence in the work that we've done in Philadelphia. I'm seeing someone put youth journey to independence program with family wraparound to support. Nice. Family peer support advocate, yes, that's something that we're hoping to see more and more to see how we can be creating more family peer support programming for family members. Provide direct family therapy, yeah. So even if you are not the person who could provide the direct family therapy, even getting that family to family therapy that might be helping them get through the crisis or work their way through the recovery process can be really, really helpful. There can be lots of different things that you see come up that you might be able to take back to your organizations. Adult siblings can communicate and share in support groups and links to free classes. Yeah, absolutely. And I note that you're commenting particularly on Alzheimer's in this situation, but yes, there might be specific areas where maybe it's a depression family support group or an Alzheimer's caring support group. Absolutely. So definitely resources like that. So hopefully you've picked up a few of the support areas that we have talked about. And again, we're going to review some more support groups again in this training as well.
Yeah, and I just want to put in a plug for peer support. It's so valuable to find a peer support group that targets individual health conditions. So like for someone with memory loss, it might look really different than having an adolescent child who is experiencing emotional disturbances. So finding the right fit for families, I think, is very, very important so that they feel connected and that they're not alone. And so let's talk a little bit about the family perspective on the information offered. There's been some research that suggests that mental health organizations, we tend to offer or behavioral health programs. We offer information to help families through the difficulties of a crisis of a family member, yet families often don't find the information helpful, believe it or not. That's hard to hear as a provider who provides a lot of information. But families, at least in one survey, felt dissatisfied about the information about mental illness. So not feeling a good understanding of the prognosis of the illness or understanding of what the diagnosis meant or what kind of treatments are available for the individual. So thinking really basic about what a diagnosis means and how they can get more information, because there's tons of research out there from the National Institute of Mental Health, from NAMI, from DBSA, from MHA. There's a lot of different organizations out there that provide great information. Also, the families don't always feel that they have an understanding of what mental illness actually means. I know in my work with family groups, they often, felt like there was a choice that the individual was making. Like, gosh, if they only tried harder, they would be able to get off that couch and go do whatever, have a job, live a life. But as we all know, that's not the way most mental health conditions work. Whether you're talking about major depression, bipolar disorder, or someone living with schizophrenia, there's just not, it's not a just pull up your socks and get on with your life kind of situation. It's very complicated. Also, families don't always feel that we do a good job as providers in sharing information. So someone early on mentioned including the family as part of the team, which I think is amazing and wonderful. However, it's a little bit challenging because I think that families don't often feel that they're part of the team. They don't often feel that they're given a seat at the table or provided enough information.
So we're going to be talking about the stages of recovery, but I did want to come back to something somebody said in the chat, which is it's important to distinguish between family and peer support advocates. And I would agree with that 100%. I work with many organizations that think because they're providing peer supports, that those peer providers are ready to work with family members. And that might not necessarily be the case, which is why we've been advocating for peer family support. This is something that's taking off in the children's world in the state of Pennsylvania and maybe where you are too. But we're really advocating for family peer across the lifespan so that family members have their own level of peer support. So I hope that there are things going on in your own area, or you're going to be an advocate for family peer support across the lifespan, because I think that there's a lot of need out there for a unique family peer experience for family members. So thank you for bringing that up. I did want to just go over the family stages of recovery. We're going to be talking about these more in depth, but there are a number of theories out there around what family member recovery is, but they almost always cover these four stages to some degree. So those stages are shock, recognition, coping, and advocacy. So as we're talking about these family stages of recovery, I think it's important to keep in mind that, again, family members are going to be moving through these stages independently of each other. They may not be going through these stages in a linear fashion. So you may, again, have family members at different stages. So we're going to be going over the different stages and talking a little bit about some of the information that family members need while they're moving through. Next. So the first stage of family member recovery is shock. So really, this is something that's really common with family members after they're experiencing that first episode of mental health with their loved one. So this stage would include feelings of maybe denial or disbelief that their family member is going through a mental health crisis, or that they have a mental health diagnosis. They may not be ready to consider that that's the reason that their family member may be going through some difficulty. So they may attribute changes in behavior to something like they've just been having a lot of stress, or maybe they haven't gotten enough sleep. But they may not be ready to connect what their family member is going through as a mental health diagnosis. You may find family members are a bit protective of their family member during this stage, and they may not be acknowledging the severity of the illness. And I think that's normal. I think most family members go through that process, but it can disrupt sort of the person's ability to recover if there's not some acknowledgement from the family member. So the idea is that you want to be able to help the family member sort of process what they need to process in order to sort of move through. Communication is extremely important for family members at this stage. And it's important to remember that family members may be feeling embarrassed that they're sharing information that might be personal, or that they feel they may be attacked or judged by other family members for sharing, or by their community at large if it's known that their family member has a mental illness. So in this stage, likely family members are going to be experiencing feelings like devastation, guilt, mourning, anxiety, or depression. And the skill that they really are going to need to build on is survival at this stage. It's also important to think about after this initial crisis or new information has has been experienced by the family. They're going to need to know some critical pieces of information. So the first thing is etiology of illness, or how did the illness develop? So we don't always know the answers to these questions. We do know that, however, oftentimes initial mental illness does happen between the ages of 18 and 25, when a person is younger. They may be leaving home for the first time. There may be, some of those moving into adulthood developmental changes that they're going through. It can be helpful for family members to understand sort of the complications of what's going on in someone's life, or some of the biopsychosocial factors that might be contributing to their loved one's mental health diagnosis. Family members also need to know what treatments will be recommended, or more importantly, how long it's going to take to see improvement in the treatment process. So for instance, if your loved one is going to be going on medication, they may not be seeing changes in their behavior right away. It may take 4 to 8 weeks in order for that medication to work, and for them to see their loved one sort of, stabilizing and, having their symptoms resolve. So it's important that family members are prepared to understand that recovery can be a process. It doesn't happen overnight. And just like, again, recovery is not a linear phase for them. It's not going to be a linear phase for their loved one either. Prognosis is also extremely helpful to talk with family members about. Family members come into the treatment setting with all kinds of perceptions about what mental illness is, what mental illness looks like. They may think that it's a death sentence for their loved one. So it can be extremely scary and intimidating to think, oh my goodness, my loved one has schizophrenia, looking at movies or news and having some of those more stigmatizing portrayals of what it means to have a mental illness. They may never have heard the concept of recovery before. So it's really an opportunity to talk with a person's family about the process of recovery, and that recovery is possible, and that there are treatments and ways to work with the individual so that the prognosis doesn't necessarily mean that it's going to be a terrible or awful illness. It's actually something that is folks can recover from. So let's talk about an example of a family in the shock stage of recovery. So Monica and James received a call from their local inpatient hospital to inform them that their daughter, Renee, was admitted. Renee is in college and lives about an hour away from home. Monica and James knew that Renee was having some sad days and challenges making new friends and adjusting to college life. Recently, when they called her, the calls were short. Monica and James didn't totally understand why their daughter was so distant. However, they believed that this was related to the challenges in adjusting. They had no indication that she was experiencing a serious mental illness or a serious mental health concern. When they were told that their daughter had been diagnosed with schizophrenia, they couldn't believe what they were hearing. So let's think about, we're going to do a little bit of a poll and see what you think Renee's family might be experiencing right now. So, okay. So what is Renee's family most likely experiencing right now? Are they experiencing anger and frustration? Are they experiencing difficulty with letting go and taking on risks? Are they experiencing devastation and mourning? Or are they experiencing transformation? So what do you think that her family is experiencing right now? I'm not sure if everyone's able to see the poll. So Dr. Zechner, are you able to see any responses to that poll? By chance, I am not able to see the responses to the poll. Kati, are you able to see the responses?
Yes, I am.
Okay.
So we have about 65% of respondents saying devastation, mourning. We have 29% or 5 respondents respond anger, frustration, and 1% transformation. And that's right now we're having 20 of 35 attendees participate. Mm-hmm.
So I'll say that why don't we give it as just a second or two to have folks weigh in. I am actually unable to see the polls on my end, Kati, so you're going to have to give me the end just a second.
Yes, and when I end the poll, I can share the results. So
Perfect. Thank you, Kati. All right, so let's see where we are. How do we do on that first question?
Are you able to see?
I am, yes.
Perfect.
As you can see, 67% of us said devastation and mourning. Yeah. So again, remember, recovery process is not linear. You may have family members who feel some of these other things, but most likely in this scenario, that family is going to be experiencing some devastation and mourning. Great. So how about the next poll, Kati, if you wouldn't mind putting that up there? Let's also check in and see what stage, what information do we think that the family members would need based on the stage that the family member is in. Ignore number 4. I'm not sure why that popped up there, but just consider those 3 questions. So information on how important, on how to improve the mental health services in their community, information on medications and treatment, or information on personal stress management. So what do you think would be most important for family members who would be in that stage of shock?
So currently we have 15, well, people are still participating.
Okay.
I'm going to see, we have 18 of 35 respondents, and the majority, we have 62% say information on medications and treatment.
Okay, perfect. So we can actually leave it at that, Kathy. That's correct. So again, that may not be everybody's need in that situation, but more so than dealing with their own personal stress, more so than how to change the mental health system in their community, they're probably going to need information on medications and treatments. Good job, everyone. So I will turn it over to Dr. Zechner to talk about the next stage.
And the next stage really is recognition. And during this stage, families to understand and recognize that this is a long-term illness, that their loved one will need support and continued assistance for this foreseeable future. In this stage, family members begin to see the limitations of the mental health system, which is when you might get some of those angry phone calls and distressed family members showing up saying, I don't understand why you can't just commit my loved one or put them in the hospital. Why can't you just do that? And of course, we know that you can't just put someone in the hospital. It can also, unfortunately, lead to hopelessness, burnout, and anger on the family members' part because they don't see the services that are available that can help them. The system isn't able to move as fast as they would like. And just that sense of disillusionment that the system will not fix their loved one, whatever that means. Many times I've heard mental health conditions compared to diabetes, which is, I think, helpful thinking about needing to take medications every day. That if you take your medication every day, it can be managed, which is certainly true. But using that kind of medical analogy may not be that helpful because it suggests that if you eat the right foods and you take your medication, your diabetes, and you keep, try not to be so stressed, then you'll manage your diabetes well. And in mental health conditions, that could be true, but it also could not be true. And it is a little bit different in terms of the stigma as well. So I think that that's helpful. And the kinds of skills that families really need during this recognition piece in particular are crisis response. What to do when they start to see those unusual things or their loved one is responding to internal stimuli or voices or hearing things that aren't there. They're going to need to know who to call and what are the resources in the community. They're also going to need to know how to negotiate, sort of negotiating and finding additional care if it is needed, working with insurance representatives to get additional extensions of care or medications, and talking about discharge plan and options. So those are sort of the key skills for this particular stage. And the kinds of information that we should be providing are things about, we have to be aware at this stage of recognition, the family's accepting that their relative has an illness that causes psychiatric symptoms. And it's important for them to really try to understand what the symptoms mean. That, if someone starts talking rapidly in a pressured speech and starts going out and spending all their money, they might be experiencing signs of mania, which they may need to get some additional care before a full-blown manic episode or psychosis starts. Or depression, what are the early warning signs of that? And being very aware of what those triggers are and early warning symptoms are, so that families can be an advocate and a support for the individual instead of, and I mean, it still happens to me to this day when my family member starts to begin to get depressed. What I see is this person acts like, I don't know how to do that. I can't do that. And I'm like, what the heck? You're a very bright person. Why can't you do that? And then it's like thunk, it takes me a while to remember that I'm a family member. And it's like, oh, right. Okay. We're seeing more symptoms here. And that means that we need to call the doctor or have a heart to heart about what else is going on in life. So it's really important that families get why they need to be kind of the sentinels, but not be, I'm going to say obnoxious about it, but not to be overly helpful. I've been accused, I will admit, of, another sign that my family member is not doing well is when there's a lot of singing that goes on. I get very concerned about mania. And then I get accused of, why can't I just let someone be happy? So it's really trying to be a balance and teaching families not to be vigilant, but not hyper vigilant, and not assume that everything is related to a symptom. So that's actually really important. Also, resources. Families need to know where to get services. In New Jersey, we're so fortunate. We have a program that's funded by our division of behavioral health services, and we have intensive family support services, or it's also called IFSS, and it's a free service where families can get referral, linkage, and supportive counseling in each county, and it's a wonderful program. You may have other programs in your area that you can link families to, so having those available and knowing when to pass those out. Also, and I just want to make a point about shock. We talked about that, and in shock, a family member, the last thing a family member wants to hear, typically, at least from my experience and families I know, is you need to take better care of yourself. So during shock, a family member is unable to care for themselves in any way, shape, or form. The only focus is this crisis that their loved one is going through. And during that time, what's most helpful is information about how to get services. In recognition, you've got a little more, and then we're going to keep moving. But I know that as myself as a provider, I certainly went always to the go-to of, hey, you know what? You should really be taking care of yourself. Have you taken a vacation lately? Are you taking time off? Because a family can't think of that in shock, and maybe not even in recognition. And lastly, I think the information that's most helpful is about medications. They need to know the benefits, the side effects, and the limitations of psychotropic medications. We know that medications are a wonderful tool, but they're not the only thing that it's going to help the person magically recover. It takes a lot of hard work and personal agency and investment in getting better. So helping families see that it is not just one or the other, and to help them talk with the person in their family about what are these medications and what are the long-term effects. I mean, there's just such horrible side effects to some of these medications that we need to be aware of, like movement issues and weight gain. So let's do a little example here. So we're going back to Renee, and her symptoms have improved, and the family thinks, great, things are going to go back to normal, and Renee's going to take the semester off. So Renee had planned to go back to her family, but they weren't included in discharge planning and had no idea of Renee's aftercare needs. This is a very common scenario that happens in my experience. And so Renee had 1 week of medication when she was discharged and a referral to a clinic. And the family continued to work to find a psychiatrist appointment after that, which is also a common problem, at least here in New Jersey at times. The new doctor prescribed different medications that wasn't covered by insurance, and that took additional time to fight that battle to get the medications. So by that time, Renee felt that she no longer needed to move home and be with her parents, but instead she was going to New York to start an acting career. So let's hear from you. If we could have the next poll, please. So what do you think Renee's family is most likely experiencing right now, given all that's happened, that Renee was in the hospital, getting treatment, she was linked up, and now she's basically disengaged from services? So Kati, what are we seeing?
So most of the answers so far, and we have 10 of 33 voting, 91%, or now it's 79% say anger, frustration. And some people are also saying transformation. But the majority of the response is still anger and frustration.
Yes. Well, you guys are on this. It's absolutely anger and frustration, probably, right? Because my goodness, they worked really hard to get all these services in place, and then nothing happened. So we can end that one and maybe have the next slide, please, or the next poll. I'm sorry. Trying to remember slides and polls. So if you were on a team working with Renee, what would have been most useful information for her parents right now? And thinking about, so she's the family is really in recognition. They're starting to see that these symptoms are continuing and that this is going to be a cycle and that they're challenging. What would you want the family to know? Kati?
So the answers are still coming in. The majority so far it's split between information on personal stress management and information on what the prognosis is.
That's really, really great. Yes. And I think you could probably go with either. I'm thinking at this stage, probably the prognosis, but also information on medications and treatment and how they actually work would be useful. Stress management, they may be ready to hear it, but they may not be ready to hear it at this stage. Again, you've got to imagine if someone's family member just had a major surgery or a major crisis, I'm not sure that they're going to be able to listen to or hear stress management, and it may cause the family to be frustrated. I know that sounds like it doesn't make sense, but if thinking about readiness, it doesn't necessarily match their stage of readiness to talk about stress management. I think families are better able to hear stress management as they go further in the recovery status. So I'm going to turn over to Valerie now.
So when talking about that stress management approach, coping is likely where they're going to be more receptive to something like stress management. So in the coping phase, you're going to see that the family is starting to realize that basically there's no quick fix to this situation, and that you're going to be sort of developing. I know people don't like the term new normal, but what is sort of falling into a pattern look like for the family now that their loved one has, gone through their initial diagnosis and is starting to sort of work through their own recovery? What does that look like for the family? So as Dr. Zechner mentioned before, I think the tendency for providers or folks who are being supportive maybe to say to families, well, you need to take care of yourself. You need to make sure that you're getting what you need to take care of the person that you love. So when you're in the coping phase, that gives you a little bit more room to be able to start entertaining ideas like that. So this might be the phase where you might start talking to somebody about, well, maybe you can take a vacation, or what resources are out there for you to be able to take some time. Do you have access to your own therapy? Can you start working through this process for yourself now that things have had a chance to stabilize a little bit? This may also be the time, though, where family members are sort of feeling out what works for their family in order to support their loved ones. So they may feel the need to start putting up more boundaries for themselves in order to have a little bit of self-preservation. And that can work really, really well. And also sometimes it might backfire a little bit if you as a family member is not sure how to approach a challenging situation. So is it coming off as nagging your loved one, or bossing your loved one, or impotizing your loved one? So that's an area that can be very helpful to help family members explore ways to allow their loved one to have some autonomy, while also sort of negotiating and working on ways to move the family forward through this process. It's also important to remember that this might be the time when families are going to start taking risks, or maybe sort of backing off of, what their contribution is to what the family is working through. So like Dr. Zechner was mentioning before, there may be some challenges on, well, is my loved one, doing these things because they're sick, or are they doing this because this is who they are, and I'm just feeling very hyper vigilant about what's happening. So it's very much a dance and very nuanced, but the skills that you want to think about of what family members need is really encouraging to manage their stress, their strain, and acknowledging that their feelings, that they may be having many feelings as a result of their family member going through this. Next slide, sorry. Thank you. So the information that family members frequently need is just basic things to also take care of themselves and reduce their personal stress. So breathing techniques can be very helpful. When is it a good time to take a break? Seeking out their own counseling, as we discussed before. And how are they getting their own supports and spending time doing what they like to do in order to help them sustain themselves during this change. Also, information on how to manage problems, as I discussed before. They may need some tricks and tools and how to sort of navigate these challenging situations with their family members. And then, of course, as we discussed before, linkage to self-help groups or other resources can be very, very helpful for the family member. So let's move on and check in with our family. So here is an example for the coping stage. So after several months, James, Monica, and Renee have had their ups and downs, but her parents have been focusing more on trying to get Renee well again. So James began working from home, and Renee took a few weeks off unpaid to be home when things were at their most challenging. So Renee did go to New York, but she came back and she agreed to try some medications. And although she still has some symptoms, she seems to be improving and talks daily about returning to school. Monica and James want to see their daughter succeed, but they worry if she's ready or not. So they're not sure if next semester will be right for her to go back. Maybe her desire to go back could be her focusing on her symptoms, or maybe that's something that's attributed to her symptoms. They also worry what will happen if she gets sick again when she's at school. They question if it's better to keep her home and safe with them or encourage her to go back out and resume her life. So Kati, if you could launch the poll. So what is Renee's family most likely experiencing right now in this scenario? So their daughter seems to be getting better. Everything isn't perfect, but she seems to be improving. She wants to go out there. She wants to try school again. So are they feeling anger and frustration? Are they experiencing difficulty letting go, taking risks? Are they experiencing devastation and mourning? Or are they experiencing transformation?
So we have 14 people so far responding, and the majority, 79%, report letting go, taking risks, and with 19% stating transformation.
Interesting, right? Okay. So yeah, the family may be experiencing some transformation in terms of how they're feeling out the situation together. But most likely it's going to be, the majority of the poll letting go and taking risks, right? This is a risk. And it's a challenge for family members to let go. And what is the right answer? There is no right answer, but how do you help family members in that process? So if you were on a team working with Renee, what would have been the most useful information you could give her parents right now? So Kati, would you be able to launch that poll? So would it be information on how to improve mental health services in their community, information on medication and treatment, information on personal stress management, or information on what the prognosis might be? So again, maybe these are things that family members will need throughout the process, regardless of their stage, but what are the answers looking like, Kati, so far?
So we have 15 respondents so far, and 56% say information on personal stress management, with information on prognosis at 24%, and then 12% information on how to improve mental health services in their community.
Interesting. So it's interesting to see some of these answers as we progress. You guys are seeing how it can be tricky, and maybe it applies to, many apply to the stage, but generally this would be the time where we would want to focus on information on personal stress management with family members. Okay. So I'll turn it over to Dr. Zechner to talk about the last stage.
And we've waited for it. We're all here. We made it to the last stage, which is advocacy. And this is sort of the last stage, but it's really accepting the illness and trying to do something about the system and make changes. They want to use those painful experiences they've had in order to help other people. And this may be that they're ready to confront systems of care, to point out limitations or problems. It could also mean they're ready to initiate something such as legislation, pushing for mental health reform, or it could mean that the family member is ready to become a vocal representative of family concerns in the community. Family members in this stage become assertive and have likely experienced an internal transformation and personal growth. This can lead to a new awareness of their power and a capacity to help their relative in a different path using the system level of services. The skills in this stage really are advocacy and organizational, and but the additional would be educational, to sort of be aware of what's out there and how they can affect the system. So for the information that's needed, family really needs information about how to engage organizational leadership, lawmakers, and others in a positive way. Families are very assertive and able to get their points across, but it's how to engage and gather support and sympathy, basically, from some lawmakers and heads of different programs to encourage that, and where they should share their stories for the most impact. they have to have information about the political process, such as organizational policies, local, state, and national guidelines and policies, and who are the key players in this. And family members need information about how to advocate, what to say, who to say it to, and how often. I'm going to give you all a quick example. We're going to kind of skip the Renee's story, but I'm just going to give you a brief example of a colleague of mine who is a family member, and his son was put into a local hospital and then discharged to services 2 hours away. And that family member was incensed because there are lots of providers in our area. Why in the world was the son sent 2 hours away for follow-up care? So he literally made an appointment with the CEO of the hospital system and met and sat down for about an hour. I mean, luckily, this person was able to have enough power and strings that the hospital system listened and tried to effectuate some changes about how they were going to discharge people based on distance and accessibility for families to follow up with the care. So we're going to skip that. And then, I'm going to turn it over to Valerie.
So just a reminder that no matter what stage that a family member is in, there are a few things that you can always do that is going to be helpful for a family member. So the first thing that you can do, again, having them link up with peers who understand what it is that they're going through. So other family peers, and you can frequently do that through things like support groups or linking them up with the local NAMI. That's always going to be a resource that's going to be available to everyone